I'd like to begin by introducing myself again. I'm Michelle Austin Pammies, one of the co-founders of the Women of Color. We are covering a topic that's near and dear to my heart. My spouse, who passed away 10 years ago, had written a book, co-authored a book on health disparities with Dr. David Satcher, a former Surgeon General of the United States. It was called Multicultural Medicine and Health Disparities. It's because the topic of how we are treated in medicine is a timely topic. It doesn't date back to the Tuskegee experiment. It's a timely topic today. Issues of access to health care and issues of how we are treated just because of cultural differences. So we will be talking today to experts in this field, experts in the field of medicine and mental health. And we'll be focused on underserved populations. We'll begin by asking each one of them to state their names and their area of expertise. So we'll start to my right.
Hi. Good. Ma'am. Okay, great. Good morning, everyone. I'm Dr. Cheryl Holder. My title now is I'm Associate Dean, Diversity, Equity, Inclusivity, and Community Initiatives at Herbert Wertheim College of Medicine. I'm an associate professor, but I'm an internist, primary care doctor in the community for many years. I now teach on the topic, even though my lived experience is day-to-day with racism in medicine and all the disparities that we deal with. So I'll go through more the definitions and issues in health and health disparities. Thank you.
Are we hearing clearly?
Good morning. I'm happy to be here. I'm Mayra Ortiz Reimer, and I work with Henderson Behavioral Health. If any of you know Henderson, it's one of the largest behavioral health agencies in Broward County. I've been with Henderson for almost 35 happy years, and I say that because they hired me when I was about 10. And I also say that because I've been with Henderson longer than I've been in my marriages. But in my defense, I'm only on my second one. Okay. As the Director of Community Support, I oversee multiple programs, including a primary care program, more intensive services such as a FACT team, which is assertive community treatment, which is basically a step down for people who are in the state hospital or facilities and institutions. I also oversee outpatient services, HIV testing and counseling, and just regular outpatient services. So I'm here today to talk a little bit about access to services, and I'm happy to be here with you. Thank you.
Hi, everyone. My name is Dr. Latasha Russell Harris. I just inherited that last name in March, newly married, as I forgot to add it even when they asked me my name. So I am a doctor of clinical psychology. I'm the president of the Association of Black Psychologists. I have a private practice that's entitled Drive-By Therapy, which actually goes along with my personality, as hopefully you will be able to enjoy a drive-by therapy experience today. That's about it. I work with professional athletes and their significant others. I work with young thugs, the police, pastors, specifically on Mondays because they empty out on Sundays and need accountability on Monday. I absolutely think I have the best job in the world.
We'll begin the conversation by talking about physical health with Dr. Holder. We'll then explore mental health disparities with Dr. Tasha. Then go on to understand how mental health disparities impact Black people in the prison system and get some information about available resources for mental health care. right here in Broward County. So the first question is for Dr. Holder. What are some of the pervasive healthcare disparities between people of color and white Americans?
Okay, to go through disparities, I always like to give a little definitions because you hear it all the time and many folks don't realize why we talk about disparities. There are always differences in health. Males, women, ages, there are always differences. But what makes something disparate is that it's preventable causes of disease that impacts a different group of people based on what has happened in our society. So people just didn't happen that black folks are sicker than white folks or brown people have things more than other people. It comes because when you look at what happens in society, we have from very early on, go back to 1600s, you cannot be ahistorical when you look at disparities. Series of assigning value to people based on their melanin production. And that was done way back in 1600s when they decided that a group of people would be devalued. When you devalue people to create the society that we have, when you assign resources, assign access, we just heard what happened with black farmers, it's no different. And that's what happens in our society. That devaluing, that assigning resource, that creates policies where you then make a group of people more susceptible to harm. So when a group of people are more susceptible to injury, harm, and decreased access to resources to adjust that health, you end up where we are. So we look at the social determinants of health, where you live, where you work, where you play, your access to the policies that drives your ability to get the money and the power to improve your health. So no surprise, we could all go through all the disparities. Blacks have higher rates of diabetes, high blood pressure, obesity, all the factors that leads you to have less access to better health, better education, to buy better food. You're living in neighborhoods that have less walkability, more stress, more pollution, more heat. And this is across the board. I don't care if you're rich or poor, the data is clear. Black folks, richer black folks, still live in more polluted environments, still live in hotter environments, and have poorer health outcomes. So this is why you see all the health issues, and we often say black folks are much more weathered, brown folks are more weathered. Look at the death rates, the life expectancy. You guys know who has the lowest life expectancy in the US right now? Black males. Who has undergone tremendous amount of oppression from the 1600s. Black men. Black women come right behind that. So you'll see that disparities in what we're experiencing should not be a surprise to anyone. Who has the highest level of HIV/AIDS in our community? Black folks. Why? Is it their skin? No. Lack of access to money and power. If you do not have ability to get better jobs, if you're living in poor environments, if there's a lot of drugs in your community, if there's unequal enforcement of laws, which then puts you in a criminal justice system, you end up having more vulnerabilities to different health problems. So we're not surprised, and we could call this all out because we've all lived it. And unfortunately, getting money doesn't often solve this. So we still see the black women, low birth weight, mortality with pregnancy. A college-educated black woman has worse outcomes than a high school dropout white female. And that again goes to how the society values the woman, how rapidly do they respond to her needs, how rapidly after the pregnancy, during the pregnancy, because many of the complaints may be minimized and not addressed. So we have to look at this.
I'd like to explore one other aspect of it, Doctor. So when I was on the Public Health Trust Board in Miami, there was a lot of discussion about the fact that you would have black people, mostly, coming into the emergency room with advanced disease. lack of access to health care? What does that mean exactly? Primary care? What's the issue?
If you look again at who gets what type of jobs, health insurance and access to primary care is determined by your employment status. In Florida especially, lower income and who makes up the lower income jobs, if you look at the history, even with the GI Bill back in the 40s, Black folks did not have access to getting the college education. They were restricted to minimal professions. Black folks didn't get the housing, so they couldn't develop wealth. So then you ended up in jobs that did not provide insurance. When you don't have insurance, you don't go to doctors often enough. When you're working two jobs, you often don't have the time and the resources to do it. So our system will tend to frame this, and I love the media because they frame it in terms of the individual responsibility. But an individual is only able to be as responsible if the structures around that individual supports it. So we do see Black and poor people will end up ER because ERs are open at night. ERs can go when you have the time. And the copay is not mandatory because it has to be valued as an emergency. The EMTALA, which is the Emergency Medical Act, allows the emergency rooms, they have to treat you if you show up at the ER. If I show up at my doctor and I don't have my $25 copay, I'm not going to be seen. So there are many, many factors that we have to address if we're going to improve the health outcomes. We cannot leave it back to personal responsibility, which is what the trust and many of the other folks are saying. Why are they always no-show? Why do they only come to the ER? It's like, why don't they tell, in the coronavirus, what was the first thing they say? Call your primary care doctor and talk about it, knowing the uninsured rate for many of poor Blacks are very high and they have no doctor to call. Yet they didn't provide a number for folks to call and find out, do I have coronavirus? Should I get the vaccine? So these are the factors that leave you vulnerable. And it's individual responsibility is only about 30% of why you're sick. Genetics is only 10% of why you're sick. Much of the other areas come with where you live, where you work, and your access to money and power.
We don't want to spend too much time on the coronavirus because I think we probably are on COVID-19 overload. However, how are we doing as a community with respect to COVID-19?
Again, this is not a surprise. I think considering the oppression and the history of medicine, we're doing better than you would expect. So we're not doing great in terms of immunization. I think it's about 30, 40%. Then much more in the northern part of the state. Dade County is doing about 70%, and our Black elderly are at the 70% to 80% immunized. Our younger Blacks, the rate is pretty low. But in terms of county, Dade and Broward are doing better for Black folks. But when you leave to South Florida, the rates are like 20 or less %, which is what drives the overall immunization rate for Blacks for vaccination for coronavirus in the 30s to 40%. If you look at the death, unvaccinated people are dying. Obesity is a driver in how sick you get. Diabetes makes you sicker, high blood pressure, so you know that the Black folks are dying at a higher rate. Hispanics are also dying pretty high rate, but you don't hear about it as much. I'm not sure why their community hasn't spoken up, but they're about 40% of the cases, and they're running 30%, much higher percentage of deaths that we don't hear about. But we do know Blacks are definitely dying at a higher rate, especially Black men.
We're going to take a turn into the mental health area. There's a term that we talk about a lot these days. It's a new term for us, but it's talked about. It's microaggressions, right? And so let's define it first before we get into it. What microaggression stands for is an aggression based on your race that's not open racial hostility, but it's there underlying. I'd like Dr. Tasha to talk to us a little bit about that, about examples of that, and whether there is an impact on mental health from microaggressions?
So even the definition is disrespectful, okay? So an expression or action or comment that subtly, okay, or often unconsciously or unintentionally expresses prejudice towards a marginalized group. Subtly, unconsciously, and unintentionally, it's like, are we just giving passes left and right? Just in case you want to go bypass the highway on this side, you can just take it here and not pay for it. You know, actually, this is a free toll. So I want to do a little something. Okay. Because there are so many microaggressions that we have even accepted to the point that we actually speak to each other in the same vein that we were told came from the white folks. But we actually talk to each other this way. So let's practice. So if we can be a little choir, get a little uncomfortable. So when in mental health, I believe, just like group therapy, this is gonna be group therapy on steroids, okay? And so you're gonna have to get a little uncomfortable. So this is a little choir, just like at church. So just repeat after me. Okay, I want you to say nude. What? The color nude? What is that? Don't ever use that word out loud of your mouth. Is it nude to your skin? Is it? It's a light, pasty tan. But I'm not gonna call it nude, because it doesn't look anything like my skin complexion when I'm nude. That alone. You have your kid get the crayon. Can you get the light brown? That's what you're gonna say. You can teach. Okay, let's talk about more microaggressions that are so interesting. How about just the fact that it's 9/11? And I had a moment of silence with the meeting that I had at 10 o'clock with the Associated Black Psychologists. But do you guys remember immediately what the phrase was in 9/11, after 9/11 in 2001? Come on. Never forget? But 400 years, why are y'all still talking about that? Literally. Isn't that, and we are okay. That's what's unfortunate. We're like, well, maybe we'll just bring it down a little bit because we don't want to make anyone uncomfortable bringing it up. But somehow we can never forget. Okay, from 20 years ago, not 400. Let's talk about how anybody ever been asked at Walmart or Target if you could help them? Raise your hand. Raise your hand. I'm gonna raise 7 of mine. What? I have a dress on? I don't have the red shirt or the blue shirt, and you're gonna ask me, can I help you find at TJ Maxx? I'm looking for the same size. How dare you? Microaggression, macro. That's even the fact that we call it micro is still minimizing that it's macro, because you are dismissing my very existence. And I'm gonna do what? Maybe small. Oh no, I don't work here, and right. We're gonna make them feel all right. Going to the section in either one of those stores and looking for your hair product. Where is it? Is it one shelf or 2 shelves that we got? Now we got 2 aisles of Pantene, Infusium, next, whatever the word, Pert Plus in all different colors, but we got 5 rubber bands and a barrette and a brush. And we are choosing as if this is our real life. Microaggression, macro. We're so used to feeling unacknowledged, unheard, unseen, overlooked. Our norm. Now let me tell you what we do to each other. Oh, you think you're cute. That's from your mama or your grandma when you walked in the room. Oh yeah, from your sister. You know where they got that from? Come on. So you please don't come, young black girl, from the back house to this front house looking cute. So I learned how to speak English. My great somebody's grandma learned to speak English auditorily, because you didn't let us read. Auditorily that's how we actually acknowledge when someone is pretty in the room. By starting with, oh, you think you're cute. This is what you do in your home with your friends or family at the family reunion. That's literally how you start. You look nice today. You learned how to speak from a white person who didn't like you. What do? Do we turn up our nose when folks say ambulance and be more pacific? Oh, you do it. But interestingly enough, when you think about language, you learn language by hearing it. So if I say ambulance, I bet you my auntie said ambulance, and her auntie said ambulance, and her great grandfather probably said ambulance, because was he able to see the U, be able to read the U and understand his phonetics? Did anybody teach him phonetics? Who taught him phonetics? Because you actually got beat for trying to read. But we, 400 years later, want to make folks feel bad about saying Pacific. When truly specific, they didn't hear the S. So teach. Don't offend, don't be offensive or judgmental. Because we only about what, 2 generations from when, how many generations are we from actually being able to go in the classroom? 3, 4, and not water ourselves down for being smart. Oh, that's you. Who waters themselves down almost every day? Raise your hand. Thank you. Because you know what? Because we don't want to be too great. We can't be too great, because guess what happens? Which is then we're taught in our own families. Then we're the sellout. Oh, she forgot where she came from. Oh, she thinks she's all that. Now she got a master's. No, you think I'm all that. I didn't say that at one time. So I'm going to make sure with my doctorate that I still make sure everybody calls me Tasha. Well, my name is Dr. Tasha. That's my everyday life. I can't tell you. I don't know how many physicians are in here, or doctors of education, or doctors of whatever. Have you ever been in a room where other doctors were just like you and somehow your name, they just dropped it? They literally just, so this is Dr. Joe with the entire long last name that I can't say. But then I'm Tasha, because you're uncomfortable putting me anywhere beside you. Let's talk about how we're always so proud to belong or to be at the table. You ever heard that? I'm just happy to be at the table. You're just proud that someone called your name and you can now come. You're literally excited about being called to the table. You made the table. Do you understand that? That's how deep this is. You have been taught to be grateful for something that you created. What? Normal. Don't get me started on the word. Oh, y'all ready for the another choir moment? Okay. Black sheep. Oh, that's the worst one, right? Because the pure white sheep is so much better. You know, the shiny hair versus the nappy hair. It's better, right? We're going to make sure the glue is all the way down to make sure we look better. That the gel and no, I'm literally saying it's deep. I have nothing. I think the beautiful thing about our hair is that we are versatile. This is not to put anyone down that has added materials in their head right now. I am literally saying the fact that you actually feel prettier with it. Or when your young daughter who's 12 years old who comes out looking nappy, and I'm gonna take this out just because this is me if y'all can't tell. Just right, and you're gonna ask her, what you gonna do with it? You gonna do anything else with your hair? Oh, is it because it's just throwing up a gang sign? Is that bothering you? Because it doesn't really move? Because this is how your hair looks underneath your material. Ain't that deep? But you're asking her or your sister, what are you gonna do with it? Because it's still not enough. Micro or macro? Macro. But we were taught to not like this. All of this. All these beautiful, I just love being nappy. I even use the word nappy. I don't care if you offended, if y'all can't tell. I get bothered. I'm sure, okay, you might have some more and I'll just keep going. Go ahead.
Do you think that microaggressions of that type are particular to African American people? Meaning, are there other microaggressions? Are they directed towards Asians? Are they directed towards?
Oh, absolutely. So I actually learned this in grad school. I went to school in Berkeley, and One of the interesting things that I remember that professors had to learn, and it was a whole students of color that we created a whole presentation poster. And so that Asian students were told that they were too quiet and they wouldn't get a lot of participatory points. So that would be where they would literally, grades were great, quizzes were great, but the participation grade was low. So sometimes they would get the A- for that. But guess what they were taught in their culture is that you don't speak when the head or the lecturer is lecturing. So in your American world of you get to tell everybody how to live and breathe, that in their culture, they're taught out of respect to stay silent. How dare you make me feel bad of what I'm actually have been taught to be? Black folks, which I always think is crazy. I went to Spelman College, so I never understood that when someone asked a question, anybody ever probably experienced this in either if you went to a PWI or even in grad school, is that like the teacher could ask questions and then there's this silence because everybody in the room is like they actually are fearful of not sounding intelligent. That's a Jewish European experience to not want to sound dumb in front of folks. Now at Spelman, the teacher asked the question, anybody read whatever article was the homework? Oh yeah, and we're talking over each other and she has to give us numbers because that's how we communicate. Now in our same room of folks that are just as intelligent in Berkeley, it's now silent. Now I know we all read this article. I remember feeling like, oh, I don't get it. That's when I felt like the only chocolate chip in the cookie. Anybody had that experience when you go to work? The only chocolate chip. You're looking for the next chocolate chip. Just how far is it? Which block do I take to just get to it? Maybe a nut, just a pecan or an almond. Desperate. And so the idea that I was saying that even with white folks, they were taught that to not sound dumb in front of people, right? So in a weird way, which we have to find on, everyone has their moments that they have to unlearn. You have to learn what you have to unlearn. Latinos, they actually, I remember this. He was like, it's almost like when I'm speaking, I'm entertaining them. What? Because you always have to hear about, I like your accent. What? Did you not hear the content coming out of my mouth? You're mesmerized by the dance. Those are a little examples.
So I just want to link all of that to
Yes.
mental health.
Let's do it.
Let's do it. Let's try to understand how these things may impact your mental health, whether you're conscious of it or not.
Okay, so absolutely, because experiencing higher levels of, this is my scholarly voice, you guys ready? When you're experiencing higher levels of microaggressions, it's linked with lower levels of mental health, meaning that you are so used to this of feeling unacknowledged, unseen, and unheard that it literally weighs on you in a way that is normal, unfortunately. So I'll never forget this. I was on the radio with Jill Tracy, 105.1. It was like midnight. And she said this, do you know that the everyday Black woman's experience when you come out of the house is equivalent to a white woman that is having a nervous breakdown? Equivalent. As in what you're holding every day as you turn on your car is the white woman having a nervous breakdown because you're dealing with so much and you're already anticipating so much. Feel that, take that in. Your everyday experience. So the fear of the future, this is anxiety, right? Fear of the future, fear of the unknown, fear of being broke, fear of being alone. When you're a widow or if you've been single and you're 58 and you're wondering when he gonna come, whatever that is, you're still fearing being alone. Or if he'll leave me while I'm married. All this is happening because of what we are used to, carrying these fears. Depression, life after what? Unemployment, infidelity, life after grief. Have you been taught to grieve? That's what comes into my couch. Like, have you really been taught how to grieve? And it could be loss of anything. Aging, loss of the independence, loss of or having to be a caregiver, which is the norm in our experience. If you put grandma in the nursing home, they all gonna talk about you. So we gotta put her in that one room to the right, but not right beside my room because she don't really need to hear what the walls are doing, right? That's where we're gonna put grandma, but that's our normal experience. And then as we put her there, we then have to patiently care for her, no matter what her attitude, grumpiness, or gratefulness is. And then you got to go to work. Oh, that's mental health. That's an everyday experience. As I tell people all the time, when you come into my office or when you on group therapy like this, I want to give you permission to be fine and then not fine. So let's feel what it's like to be fine. How are you doing? Everything's fine. Y'all feel what it feels like to be fine? You said it today when everybody said how you're doing, right? So now that we did that, now let's not be fine. And then now let's sit on the couch. So to say out loud, let's scream this. So I scream this almost every other week, maybe to my steering wheel. I asked you to practice this. Just repeat after me. I'm overwhelmed.
I'm overwhelmed.
What? So we just gonna say it all watered down like that? Like you're not overwhelmed? I'm overwhelmed. Just to acknowledge it, just off top, just right there, you get to drop that. I'm actually overwhelmed. You can feel it in your body saying it's okay. Giving your permission even to be sad or to cry. You didn't see your mom cry. Unfortunately, as I talk to all parents about that, or daughters, it's actually not good that your daughter didn't see you cry, because now she's in my office thinking that she's not as strong as mom because you hid it. Or in the West Indian culture, which I've learned as a Black American, now that I'm in Florida, I'm just one-on-one like, oh, okay, this is what it is. So there wasn't room for emotion in the West Indian household? No. Does it historically make sense to me? Absolutely. But the fact that it's the norm, let's call it that. So this emotion that you're having, you're actually judging yourself. What is this sadness that I'm feeling? What is this anxiety that I'm feeling? Let me just disassociate, just like the prostitute does every day or the stripper does to get through her job every day. Let's disassociate. Let's act like this isn't happening and go into another reality and then move there. It's called literally releasing from emotion.
I'm gonna ask
Oh,
just one
sorry,
more.
yes.
No. Interrupting is what I do.
Okay, I'm
Yes.
ready. Okay, got it.
Professionally.
That's
So
fine.
the thing is, the microaggressions have a mental health component. Do they have a physical health component, Dr. Holder?
Good question.
Absolutely. What we see when you see with the pregnancy, there's the cortisol level because it's all stress. So we have a thing, we call it allostatic load. That's the medical term. But it's basically your body reacts. You may on the outside exhibit this calmness, but in the inside, your stress hormones are rising. We see that in pregnancy that we think it increases the cortisol, which increases oxytocin. So the pregnancy thinks that it's at term earlier because of the levels. And everyday microaggression, it hurts you. We see that with blood pressure, we see that with diabetes, where your insulin resistance is higher. So a lot of some of the health effects, the health disparities we see comes from the day-to-day racism that people experience. And so it sounds small when somebody says, can you help me? And all in medical school, it was constantly asking me to do the nursing assistant work. And I'm trying to always, because it increases my workload, trying to be a doctor and a nursing, increasing your stress takes its toll. So absolutely mental health, but your physical health is also affected, even though you don't realize it.
And let me add to that, because that's people will come to her before they'll come to me, because I have a headache, right? And my stomach, I just can't keep anything down. But you're still in the same stressful relationship you've been in for 12 years. But we want to ask her for the pill. We don't want to change our lifestyle, right? Or prescribe the pill or whatever it is. And I hope, and I guess the same stomach, I can think of like stress of just being tense when you wake up and you are literally tense when you get out of the bed. Headaches, I've heard that people will come to you to find out what can you do to help me with them. I'm trying to think of anything else that's physical that eventually, which I love, you guys end up referring the patients to us. Like, we actually aren't finding anything, meaning that we may need to talk about what's really going on, which are your stressors that you are dismissing.
So we're going to let Myra tell us a little bit, because Myra is on the ground. She's every day at Henderson Behavioral Health dealing with the mental health issues of this population that we're talking about. So, Myra, what kind of resources are out there for mental health problems?
Like as they said, I love my job, and the reason I love my job is because I touch people every day. I touch the lives of people, especially the people that need the service the most. Um, there are a lot of services out there, and access is basically out there. But unfortunately, for various reasons, including culture that we spoke about, um, if I spoke to you today and I said that I have schizophrenia, or if I have depression, or if I'm an alcoholic, generally speaking, the thoughts about me would not be very positive. It would look like I have a weakness, that, just drop the drink, you can stop, et cetera, et cetera. However, if I told you that I had diabetes or that unfortunately I was diagnosed with cancer, there's empathy. So we are taught, from little, and still, I always say we've come a long way, baby, but we're still not there. There's a lot of stigma associated with people with mental health conditions. And again, the media and um, there's a lot of ways that we try to improve that, but it still exists. For example, in the state of California, in certain areas, everybody will, a lot of people go to a therapist or they go to a psychiatrist, etc. And it's almost like going shopping, grocery shopping on a weekly basis. Oh, who's your therapist, et cetera, et cetera. However, in some of other parts of the country, there's a lot of stigma associated and continues to be. With that said, unfortunately, it keeps us from accessing certain services that are in our area. In Broward, though, we're happy to say that there are services likewise nationally. But one of the things that are very readily available, just like most of us know 911, the 3-digit number, most of us teach our children that's an emergency number. If you have a medical issue, something happens to your sister, to your brother, to your mother, to your father, dial 911. We teach our kids even from young. Um, Likewise, I don't know, I'm aging myself a little bit. Who remembers 411? Right? If I ask my teenage kid that, he says, "What? It's 411, right?" What do they do now? Google. It's called Google, right? That's how you find out everything. Well, historically, there is a national number. It is called 211. That number is powered by thousands of employees plus volunteers for information. They are there. It's a 24-hour, 7-day-a-week access line, and it is information regarding counseling, regarding resources and services. The information is anonymous, confidential, but it's available to everybody. Unfortunately, it's not well known as 911 is and 411 used to be, or Google is today. But they help with resources such as food, housing, transportation. If people need to know where shelters are, if concerns regarding daycare, emotional, physical, domestic abuse, mental health services, substance use services, and the like. So there's a variety of referrals. Sometimes within the communities, they also assist with trying to link those individuals to those resources. So again, it's really important for us to be aware of that. Likewise, it behooves me not to mention that there is a national line too regarding suicide. Remember, suicide is the 10th leading cause of death for a group of people like 14 to 34. That includes our children. That includes us. Unfortunately, we are afraid to talk about suicide. We often think that if we mention to our children, "Are you having thoughts of hurting yourself? Are you thinking of is your, that you're worthless and that are hopeless, and that maybe life is not worth living?" They think that sometimes when we mention those things to our children or to our loved ones, that it may put in that seed of, maybe this is an option, maybe this is an out, etc. But at the end of the day, it is an opportunity to help them speak about it. The national line is, which is not, the number is not as familiar, is 1-800-273-TALK. It's broadcasted in many places, but the National Commission, Communication Commission, the Federal Communication Commission has designated a 3-digit number, which will be in effect July of 2022, that will be 988. And this is going to be just like 911, is going to be 988, and I'm sure that it'll be marketed and advertised as we come nearer to its implementation. But this is, I think, an opportunity for us nationally to be able to provide that information to our children, to our families, and to those that are thinking of hurting themselves in any type of way. Um, with that said, and I know we don't have a lot of time, I do want to talk about a few programs here within Henderson. We have anybody who needs at any time of the day, and this is in Broward County. But remember, they have a lot of these programs through not just throughout the state, nationally. And again, if you call 211, they will tell you about these services and these programs. But we have a mobile crisis response team that goes out to anyone in the community, children as well as adults, any time of the day, 24/7, 24 hours a day, 7 days a week. They screen the individual. It's a line that you can talk to someone, that for any help and assistance. They do go out into the community and assess the individuals at their homes. They talk to their families, etc. So they include the family as part of the support system for anybody who needs help. With that said, if they deem that the person needs further evaluation, they make those type of arrangements and take and arrange for them to be transported and taken to a receiving facility where other further psychiatric evaluation can be performed on the individuals. I do want to say something that highlights Broward County, because I do work in Palm Beach County as well, because Henderson extends through both counties. Here in Broward, most providers, if they are thinking of sending or recommending what's called a Baker Act, which is to an involuntary evaluation for someone who is in need of that. We do have officers that are trained in mental health issues, etc., and they come in BSO, which is the law enforcement agency that basically transports. Now, if you call the police or you call law enforcement because somebody in your house is experiencing mental health conditions, etc., we do understand that the police obviously come out. But look at what's happening. They are criminalizing people with mental illness. It's like my son told me, and he goes to college in the state of Florida. I'm not going to mention what county, but he says, "Mom, the police came because somebody was not doing well. She was crying hysterical. We didn't know what was going on with her, et cetera, et cetera. Clearly, she had some mental health issue. I'm not sure what was going on, but the police came and got her and handcuffed her and put her in the back of the car." Now, if I have, if I'm dizzy, I faint, or any other medical condition, and I call 911, the ambulance comes, and although sometimes they are accompanied by law enforcement, I understand that, but generally you are taken in an ambulance to a hospital. However, if you have a mental health condition and you need to be taken to treatment, generally is a law enforcement, is a police officer, is a car that says police, etc. Well, these, which is very unfortunate, what is it doing? It's criminalizing a mental illness because you have a mental illness. So again, the sheriff has a few vehicles out there. They're unmarked cars. They do not come in uniform, and they come out and they understand that that this person has a mental health issue versus that they are a criminal and needs to be handcuffed, etc. So they take and they escort them and they transport them to the nearest receiving facility. So I think
One little bit of interruption. So I think it's interesting that we hear a lot about the rate of arrest and the rate of inmates that are black, basically, in the criminal justice system. Some of it has to do with drugs and the drug war. How much of it would have to do with mental health?
we know, and those of us in the field say, that the largest provider of mental health services in the country is the jail system. And that's really, really sad to say, because we know that people with mental health conditions now, and before I say that, I do want to say one thing, that although, in my field, I've been in the field for a long time, and when I tell people where I work or what I do for a living, they say, "Are you not scared? Are you not afraid of the people you serve?" And I said, I am more afraid of the quote unquote normal people that call themselves normal people, that I'm walking in the street and they're walking behind me, etc., that may be out there to commit a crime against me, but not the people that I serve. They're more likely to have violent victims of violent crimes. So I want to say that first. So unfortunately, sometimes the people with behavioral health issues may not follow the laws or the rules all the time because they, if their minds were there 100%, if they were fully cognizant, that then they would be seeking treatment, etc. So unfortunately, they do get picked up, and the jails are full of people with behavioral health issues and mental health concerns.
We are about to wrap up. So, in order for us to do that, there's so much to say, right? But in order for us to wrap up, I'd like not to leave without you saying, each one of you, one key thing that you forgot to mention that you'd like to get across. Start with you.
I would like to
Ivor.
say that there are services out there. We do have drop-in centers. We have a centralized receiving center that's in Lauderhill. We look at our data and we try to put facilities and programs in areas that mirror the people in our community. So if we have a certain percentage of Black people in our community, of Hispanic people in our community, of Caribbean Americans, etc., we try to mirror those areas. So we try, and just as a go away, you're not alone. We're here with you, and together is how we're going to get through this. So thank you.
Dr. Holder?
Health is more than what happens to your physical body. So if we are going to improve the health outcomes of our community, we have to look at where you live, where you work, where you play, your access to money and power, which is driven by policies. So we must vote, we must get educated, we must address everything around us. I leave you real quick. My grandfather lived till near 100 years old. He probably went to the doctor 3 times in his life. He lived in a community on the top of a hill in Jamaica where he had exercise regularly, a supportive environment, quality food, quality water, and a supportive, loving family. Much of us in the Black community have the supporting, loving family, but we don't have all the other resources around us. So unless we address health as addressing what the society is doing to us as a community, we're not going to have better health outcomes.
And Dr. Tasha?
So we have higher rates of rage collectively because we are collectivistic people, which can be a double-edged sword. So we feel it because you feel it. We feel it. And so that also, in terms of mental health or psychology, that would be called vicarious trauma or secondary trauma, as in, because I witnessed domestic violence, I'm actually also being abused. My eyes cannot unsee this. So unfortunately, as I like to talk about the 400 years of unacknowledged trauma that we still feel through macroaggressions, is that the idea of just shut up and take it is not okay. And so when you feel what you feel, I want you to allow yourself to feel what you feel and to then talk to someone about it, be it a professional, be it someone that you trust. Sometimes folks go ministry, which is fine also. But I definitely wanted to do this before we left. Can everybody look at one person? And I want you to say, each of you are going to say, right now, say, I see you.
I see you.
And then you say back to them, I see you too.
I see you too.
Because we all need to be seen and
I'd like
heard.
to thank these extraordinary, competent women for taking their time this morning to discuss a topic that is of interest to us all. Because when we're talking about multicultural disparities, we're talking about we as a group having a negative result with respect to how we're being treated in our health. So it's of concern to us all. So thank you very much, ladies.